Hi everyone, my name is Michele Hernandez, and this is my poster on the longitudinal characterization of inflammatory biomarkers concurrent with the progression of an injury-induced model of osteoarthritis. Osteoarthritis is a chronic and progressive degenerative joint disease characterized by the progressive loss of articular cartilage, changes in subchondral bone, and inflammation of the synovium tissue. According to the CDC, it affects nearly 33 million people in the US and is one of the leading causes of chronic disability. Currently, no curative therapies are available for this disease, only ones to help manage the pain. About a year ago, we conducted a pilot study that set the stage for the two ongoing studies in my lab today. This 3-week study that I will be talking to you about today, and a longer 6-week study that is also in progress. In the pilot, we demonstrated the feasibility of longitudinally monitoring immune responses in an injury model of OA. We were able to see some elevated biomarkers in the injured group when compared to the controls. However, nothing was deemed significant. With this study, we introduced the variables of male versus female, as well as a therapeutic to analyze how these factors could be impacting early biomarkers in an injury model of OA. The therapeutic we utilized is currently being tested in phase 2B of clinical trials. Thus, we would expect its effectiveness here. With this study, we aim to identify early immune biomarkers that may be indicative of the disease status. Moreover, we hope to specifically target those for potential therapeutics delaying the degeneration of articular cartilage. So for our model, we used a well-established model known as the medial meniscal transection model in the rat. For this, an incision is made in the medial side of the knee. The medial collateral ligament is exposed by dissection and then transected. This exposes the medial meniscus. The meniscus is cut, simulating a complete tear. By cutting this creates mechanical instability that does not get repaired and leads to joint destabilization and intra-articular inflammation. In order to quantify these changes that have occurred during the disease, we used contrast-enhanced microcomputed tomography, micro-CT. First, we submerged the tibias in a solution containing a contrast agent. Then we scanned these and we created 2D grayscale images, which then were turned into 3D representation of tissue and bone. With this analysis, we can measure quantitative OA metrics such as cartilage thickness and volume. In order to quantify the immune response, in this animal model, we use longitudinal blood draws and synovial fluid aspiration. With the animal in a supine position, we collected blood using the tail artery. This was done weekly for the duration of the study. We also conducted an endpoint synovial fluid aspiration using a joint lavage method. In order to identify the circulating immune cells, such as T cells, macrophages, and B cells, we utilized flow cytometry. Immune cell levels will be measured at baseline prior to the surgery, 2 days post-op, and at 1 week, 2 weeks, and 3 weeks, which is the endpoint. Luminex will be used to measure circulating inflammatory cytokine levels in both the blood and the synovial fluid. As I mentioned before, this study is ongoing, so while we have not had the chance to run all of our analysis for every subject, we have run micro-CT evaluations on a few samples thus far, depicted here. Here we have the data normalized to starting weight. We normalize the data here to the starting weight because of the fact that we have males and females, which differ in weight pretty significantly. Weight has been shown to have an influence on how much damage can occur in OA. This is why weight loss is one of the first methods of treatment that doctors prescribe to patients with this disease. So far, we see a possible sex difference with the OA treatment. As you can see here, the females, regardless of intervention, there is not that much of a difference within the cartilage thickness. However, when you're looking at the males, we can see that the group that received the therapeutic had much more thickness than the ones who received no therapeutic. This is also noticed here with the male that received no therapeutic showing a lot more damage than the male with the therapeutic. Here you can see pits and lesions, which are indicative of heavy damage. These results suggest that this could be a possible indicator of sex differences in how this disease progresses and how they respond to treatment. This will be interesting to investigate whether the differences we are seeing here are real and continue with more analyzed samples in the future. And it will be exciting to see whether there is a correlation with these differences and specific immune biomarkers among the two sexes. So our next steps for this study are to continue and taking our two 3D grayscale images from all of our samples and running a MATLAB code that was created by our lab to calculate surface roughness of the cartilage, and compiling that data with our other quantitative OA metrics, as well as completing the micro CT evaluations for the 3-week study, as well as the ongoing 6-week study I mentioned. From there, we plan to employ linear and nonlinear multivariate regression techniques to identify immune biomarkers and see if any of these are correlated with the surface roughness and other OA metrics of the articular cartilage. The overall hope with this research is to one day be able to perform a simple blood test after a severe knee injury and be able to know the disease status of OA, thus being able to intervene in the early stages to delay any further degeneration rather than discovering the disease once the pain has manifested and the disability has occurred. Lastly, I would like to thank the Knight Campus Undergraduate Scholars Program, as well as my lab, the Goldberg Lab, and all my fantastic mentors for making this research possible today. Thank you all, and thank you for listening.